Statement on Omicron variant and holiday recommendations. Holiday recommendations in regards to Omicron. The Minnesota Commissioner of Health, Jan Malcolm, issued this statement today regarding the increase in spread of the Omicron variant in Minnesota and the recommendations for the upcoming holiday gatherings. Minnesota is preparing for an increase in COVID-19 cases in the coming weeks driven by the Omicron variant. As reported by the CDC earlier this week, the Omicron variant is the dominant strain in the United States, and based on laboratory data, we estimate it's now the dominant strain in Minnesota. This aligns with evidence that we've seen that Omicron spreads much easier than earlier variants. The quick rise of the Omicron variant underscores the importance of everyone taking steps to slow its spread so we don't overwhelm our already stressed healthcare system. We have nearly 3.5 million Minnesotans fully vaccinated and protected, and more Minnesotans are getting vaccinated and boosted every day. We have the tools and the knowledge to respond more effectively than at any other point in the pandemic, and the federal government will be providing additional resources for testing and healthcare support in the weeks ahead. As Minnesotans prepare for holiday gatherings, regardless of vaccine status, it is essential that we all use multiple layers of protection to avoid the worst impacts of Omicron to protect our families, friends, and neighbors. These layers of protection include: number 1, get vaccinated. Minnesotans ages 5 and up can be vaccinated. Vaccines are the best way to protect yourself and your loved ones, especially those who cannot be vaccinated and children under the age of 5. Another thing you can do is get boosted. All Minnesotans 16 and older should get a booster when they are due. That's about 6 months after receiving the Pfizer and Moderna, and 2 months after receiving the Johnson & Johnson. Researchers believe that the Omicron variant is more transmissible than previous variants, but getting fully vaccinated and boosted significantly increases the protection against severe illness or death from the infection. You could also get tested. Even if you're not experiencing any symptoms, test before gatherings just to make sure you're not spreading viruses to others unknowingly. Take advantage of one of the many free testing options the state has to offer, or make an appointment with your local clinic or pharmacy. If you are using an over-the-counter at-home rapid test, use it as the closest to your gathering as possible. If you do indeed test positive, no matter what type of test you took, stay home. If you are negative, you should get tested again if you develop any symptoms. Lastly, stay safe. Wear a well-fitting mask while traveling and in indoor public settings like the grocery store, a shopping mall, or at school. Wash your hands and do your best to avoid crowded indoor spaces before getting together with your friends and family, especially high-risk loved ones and children under the age of 5 who cannot get vaccinated. Know the vaccine status of those whom you are gathering with to make sure that everyone is safer when together. The bottom line is that if you are vaccinated and boosted, get tested before you go and mask indoors when you're in public. You can enjoy a safer holiday with your friends and your family.